When is informed consent required for medical treatment? In recent discussions about healthcare, one question stands out: when is informed consent required for medical treatment? This topic has gained attention, especially as more patients seek clarity about their rights. Understanding informed consent is vital for anyone considering medical procedures. So, let's break it down. Informed consent is necessary when a patient is about to undergo a treatment or procedure that involves more than minimal risk or complexity. This means that if the procedure could lead to significant side effects or complications, consent is required. Patients must give this consent voluntarily, without feeling pressured. For example, informed consent is essential when the treatment is complex or carries notable risks. This includes procedures involving general or regional anesthesia or sedation. It is also necessary when the procedure is part of a research study or clinical trial. Patients should be aware that if the treatment could impact their employment, social life, or personal life, informed consent is also needed. In cases of routine or low-risk procedures, like basic personal care or blood sampling, formal consent may not be required unless the patient has previously declined similar care. In the context of clinical trials, informed consent must clearly outline the purpose, procedures, potential risks and benefits, and any alternatives available. Patients should receive enough information to make an informed decision about participating. Two main standards guide what information must be disclosed. The first is the reasonable physician standard, which requires that a typical doctor would disclose what is necessary under similar circumstances. The second is the reasonable patient standard, which focuses on what a typical patient would want to know to make an informed choice. Healthcare providers should communicate relevant information clearly and in understandable language. For minors, consent is typically obtained from parents or legal guardians. In the realm of telemedicine or remote patient monitoring, consent must be obtained before the first encounter and renewed periodically, often on an annual basis. Informed consent is essential before any medical treatment or participation in trials that involve more than minimal risk. This ensures that patients fully understand and agree to the care they are receiving.